name is Michael Guadalupe. I am the volunteer coordinator with AiArthritis, and I'm talking to you today about non-medical switching of your prescriptions and why this should be important to you. So, uh, for those of you with autoimmune and autoinflammatory arthritis diseases, you know that there's a whole process of diagnosing your disease. Plus, finding the treatment could be just as much of an ordeal as diagnosis. Sometimes the first treatment that you use is fine and it works, but a lot of us with these diseases will go through 2, 3, 4 medications before we find one that works for us. They take a long time to test too. So you're 30 or 60 days until you know if the drug works. So every time you switch medications, you're just extending the time that you're not getting treatment or effective treatment. So when you go in and you get a prescription from your doctor, your pharmacy or your most likely your health insurance may tell you need to switch off that drug. So the medication that's working for you, and it's usually a biologic. Obviously, there's other it's types of medications that are expensive, but for the AiArthritis community, it's usually a biologic. They're asking you to switch from one to the other. So it might be a biosimilar, or it might be just another biologic altogether. But all these drugs are intended to do the same thing, and that's to relieve your symptoms and to stop the progression of your disease. So, sometimes they do it the same way, like a biosimilar, which has been tested and is supposed to work just like the main one, or it could be another, like I said, another class of drugs. So the insurance company has made this decision for you without the consent of your doctor, without your doctor's input. So now it should matter to you because first off, they're just doing it to save money, which is fine. However, your health should be the priority, especially when you have something that works, because sometimes you'll come off the drug that works, try another drug that may or may not work. And let's say you have 2 months and you find out the drug that the insurance company said that you need to take before they'll pay for anything else, before that fails. And then you go back to the first drug. Now, sometimes that first drug won't work for you just as well as it used to work. Things happen. There's things in your body that change, and the drug just doesn't work for you. So the reason non-medical switching should concern you is because they're doing it without your doctor's consent, and they're doing it with regards to their pocketbooks and not your health. So you really want to make sure that you're informed and you're looking into that. Another way they do non-medical switching, as I discussed in the other video, is they may change your dose or your delivery method. And again, these might be just to save a couple bucks. So it might change your dose, so you make it higher or lower, or more frequent or less frequent, depending on how they can work it to save a couple dollars. So that's another thing you should be looking out for, and it should be very important to you. And as soon as you hear about these things, your doctor will know about it, I'm sure. Sometimes they don't because there's just a lot of working parts, but message your doctor, call your doctor, and try to find out a prudent path for you forward. There's a lot of hard decisions depending on where you live and depending on the insurance you have. But just trust your doctor if you have a very good relationship with them. And that goes back to you choosing the doctor that you like. So hopefully this helps you out. And if you need anything else, keep looking at our Knowledge Equals Empowerment videos. Thank you. Have a great day.